everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. Members of the White House Coronavirus Task Force testified on Capitol Hill Tuesday as 26 states report an increase in new COVID-19 cases. At least 18 states are also reporting an uptick in hospitalizations over the last 2 weeks. During his testimony, Dr. Anthony Fauci warned that the number of deaths often lag behind infection rates. Members of the task force also confirmed that President Trump had not asked them to slow down testing, as he claimed during Saturday night's rally. The government's top doctors also refuted the president's assertion that the recent surge in infections is due to more testing.
Before you start talking about what a second wave is, what we'd like to do is to get this outbreak under control over the next couple of months so that when we enter into the fall, early, late, and then early winter, that we have such a low baseline. I, as a member of the task force, and my colleagues on the task force, to my knowledge, I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact.
Has President Trump ever directed you to slow down testing for COVID-19 in the United States? Dr. Redfield?
No.
No, sir.
But the early data that we're seeing regarding the immunogenicity and the induction of good responses makes me cautiously optimistic, always knowing that there's never a guarantee. I have not directly recommended to the president to wear a mask, but I think it's very clear to anybody in the country, because I talk about it so often, of the importance of having physical distance with a mask, and if you are going to be either beyond your control or by your own choice in a crowd, that it is imperative to wear a mask at all times.
Dr. Bob Lahita joins me now. He is a professor of medicine at New York Medical College and chairman of medicine at St. Joseph Healthcare System. Doctor, thanks very much for being with us. What were your big takeaways from today's hearing?
Oh, there were many takeaways, Elaine. The first thing is that Dr. Fauci reaffirms the fact that there's 30,000 new cases in the Sun Belt. That's very, very worrisome. And people are telling me, well, it's young people and they're immune to the virus. That means that they get infected, but they don't get as sick as older people do. But that's not good enough, because testing is extremely important. And I agree with Dr. Fauci and Dr. Redfield that testing has to be increased. We have to track patients. We have to know who the infected people are, who can infect large crowds at rallies, at bars, at beaches. And all of this is going to result in an uptick. 30,000 new cases is very depressing, because those people down there who are infected can come back to the Northeast, where we're now taking deep breaths and beginning to relax a little bit, although we still see cases up here, not like it was back in early March and through April. It was a disaster, but I'm hoping that doesn't happen again.
So with respect to this uptick in cases in the Sun Belt states, was it just young people that task force members attributed those spikes to? Was it something else in combination with that?
I think it was a combination of young people and older people. I think we pretty much now know that nursing homes are fertile grounds for this virus, and the precautions taken at nursing homes and with the elderly who are compromised with congestive heart failure, diabetes, hypertension, we know that that's a population that has to be protected. But young people are very cavalier now. They feel that they're invincible. And remember, we have syndromes that particularly affect young people below the age of 20. So to say it's safe to go out into a crowd and cough and sneeze over everybody. We know what happened in that bar in Miami, or I think it was South Florida, where one woman infected 20 of her friends, who were none of whom were wearing masks, and they're all very sick now. So this is very, very, it's a time, as Dr. Fauci and Dr. Redfield said, for caution. We have to be cautious. We can be optimistic that there's going to be a vaccine coming, as they said. There are many new agents that we have to control the disease. But from my friends in Arizona, Texas, New Mexico, Florida, they're telling me the ICUs are filling up. It's just as it was here in the Northeast, and they're filling up with young people and old people. Age doesn't make a difference when there's that kind of a pandemic surge, and it is a wave. It's a horrible wave.
So Dr. Fauci and CDC Director Dr. Robert Redfield were also asked about reopening schools in the fall. I want to play some of what they had to say.
So it's up to the local officials to evaluate where you are in the particular region, what the recommendations that we really very carefully put out about the guidance of opening schools. So you don't want to make one size fits all for the United States.
I think first and foremost, it's really important that we continue to take this time to continue to accelerate our capacity to diagnose obviously readily available timely test results, build that capacity for isolation and contact tracing. That's going to be critical for what we're doing. Secondly, we do have to reinforce in the American public the importance of the social distancing interventions that we've discussed, particularly face covering, 6 feet distancing, and hand washing.
So, Doctor, do you believe it will be possible to resume school in the fall?
Well, Elaine, that's a tricky question. I watched Dr. Redfield and Dr. Fauci, and they are as concerned as I am with regard to opening school. Now, an elementary school with children in it, it's going to be extremely difficult to have social distancing and have little children wear masks. I agree that they are not as vulnerable to the infection as, say, college students or millennials that are out of school. But it is a concern. Someone said to me, well, let's open colleges. But colleges, social distancing is incredibly important, and wearing masks, because this is a vulnerable population. Anybody, including little children, can be infected by their parents, or vice versa, can go home after carrying the virus or being infected by a friend and bring it home to their parents, who are adults and may be susceptible. And this is in particular the case with grandchildren who may be infected. And I'm often asked by relatives, can I hug my grandchildren? And the grandchildren either have been exposed or may have a parent that has the virus, and they're going to their grandparents and hugging their grandparents. And it's very dangerous at this time.
You know, everyone is wondering about the time frame for a vaccine. Dr. Anthony Fauci said that he remains optimistic that there will be a vaccine in early 2021. Do you share that optimism?
I do, Elaine. I'm cautiously optimistic, like Dr. Fauci is, to borrow his term. The reason I'm cautiously optimistic is we are very, very much more advanced molecularly with the production of a vaccine. We have several means to produce vaccines. The most common mean is an attenuated virus, which is the old way that we made vaccines against measles, German measles, mumps. But then we have new mechanisms where we create vaccines by fooling the immune system with something called messenger RNA, or with taking parts of the virus, fragments of the COVID-19, and sending them into the body on the backs of another virus that's harmless, sort of a carrier pigeon that brings the virus into the body and allows the immune system to think that you've been infected. Now, that's very easy to produce. The main drawback with these vaccines is to have enough clinical testing in large populations, phase 3 and phase 4. I think they're fairly safe. But right now, we want to see that we can have the vaccine proven so that neutralizing antibodies form and that you're protected.
All right, Dr. Bob Lahita, it is really valuable to have your insight. Thank you very much for joining us.
Thank you, Elaine. It's a pleasure to be here.